Broviac flushes and cap changes. The Broviac will require daily flushing with the heparin solution. By flushing, we mean putting the heparin into the Broviac. The heparin solution prevents blood from clotting in the Broviac. Before you begin any care of the Broviac, be sure to wash your hands. Some places use plain heparin to flush the catheter, but at the Golisano Children's Hospital at Strong, the practice is to use a solution called heparin vancomycin, or Hep-Vanco. Before you flush your child's Broviac, you should get everything together that you will need. The materials you will need are the heparin solution, the dispensing pin, an empty 10 cc syringe, and an alcohol pad. Start by taking the top off of the heparin Vanco and clean the top with an alcohol wipe. Open the dispensing pin package, remove the plastic covering at the bottom, and attach it to the heparin Vanco bottle until it snaps. Wipe off the top of the dispensing pin with alcohol. Take the 10 cc syringe out of the paper package that it is in. Place the syringe on the top of the dispensing pin and twist it until it is on tightly. Turn the heparin bottle with the syringe attached upside down. Pull back on the plunger until the black end is at the number 5. This may be different for younger children and babies as their Broviacs are smaller. Check with your physician or nurse practitioner about the exact amount your child's Broviac will need. Take the syringe off the heparin bottle by twisting in the opposite direction from when you put it on. Now you need to make sure that any air that may be in the syringe is taken out. To do this, you will point the syringe up and pull back the plunger so that the air rises to the top of the syringe. You may need to tap gently on the syringe so that the air can rise. Keeping the syringe pointed upward, slowly push the plunger up until you see the fluid coming out the top of the syringe. Be careful not to go too fast or the Hep-Vanco may squirt out of the syringe. Now, put the heparin syringe in a clean place until ready to use. You are now ready to flush the Broviac. Holding one of the ports of the Broviac near the cap, clean the cap off with alcohol. While still holding the Broviac with one hand, attach the syringe with the heparin to the end, twisting it on so that it is attached to the cap. Now unclamp the Broviac clamp. Gently push the plunger on the syringe so that the heparin is flushed into the Broviac. Just as the fluid in the syringe is almost gone, clamp the catheter. Remove the syringe by twisting it off the cap. Put the syringe in the container you were given, or in a laundry soap bottle. Make sure this container is kept in a safe place. Broviac daily flushes with cap change. The caps on the end of the Broviac will need to be changed at least twice each week, and every time the blood is drawn through them. Caps come in different sizes and colors. Which one your child has depends on the company you get them from. The caps should be changed at the same time as the catheter is being flushed. When getting the heparin out of the bottle that already has a dispensing pin attached, you need to clean the top off with alcohol, just like the first time. You will draw up the Hep-Vanco just like the first time, making sure you get all the air out of the syringe. After the heparin is drawn up, you will carefully open the package that has the new cap in it. You will attach the heparin to the end of the cap, being careful not to touch the end with your fingers. Remember to twist the syringe on the cap so that it is tight. Put some Hep-Vanco solution gently into the cap to remove the air in the cap. Place the syringe and cap in a clean place while you get the Broviac ready. It is important to make sure that the Broviac is clamped before you remove the cap. This will prevent any air from getting into the Broviac. Holding the plastic part of the Broviac in one hand and the cap in the other, remove the cap from the Broviac by twisting it off. You will need to wipe off the end of the Broviac after the cap has been removed with an alcohol pad. You then attach the cap with the Hep-Vanco syringe attached to the Broviac and twist it on. Make sure it is tight so the fluid won't leak out of it. You then unclamp the Broviac clamp and flush the heparin into the tube as you did with the other port. You have now completed the flushing and cap change. Remember, there may be 2 and in some cases 3 separate tubes, and all of them need to be flushed every day. Please remember the Hep-Vanco bottle has enough in it so that you can get several flushes out of one bottle. It is not necessary to change the dispensing pin every time you take heparin from the bottle, but a new one should be used with each new bottle of heparin. Make sure that the Hep-Vanco is put back in the refrigerator and the syringe in a proper container and in a safe place. And as always, keep the Broviac tube safely taped.